It is a huge honor today to be podcast interviewing Joy Moeller, RDH, BS, BE, a Myofunctional Therapy and Associates. You can find her website at joymoeller.com. That's Joy for Joy, Moeller, which sounds like the tooth molar, but it's spelled Moeller. You should change your name to just Moeller, Molar.
I should.
Come on, you're a legend in dentistry. You should just correct the spelling on that once and for all.
But you know what? The truth is, I'm from Flossmoor, Illinois, too.
You what?
I'm from Flossmoor, Illinois.
Oh my gosh, that is hilarious. That's where you were born and raised?
Yeah.
Because now you're a California girl, right?
Yeah.
We're Beverly Pacific Palisades and Beverly Hills?
Correct.
Yeah. I was gonna move to Beverly Hills, but I couldn't find a lot that would zone my double wide trailer. And so HOA, Joy Moeller is a dental hygienist who has worked as a myofunctional therapist for over 35 years. Myofunctional therapy, known as OMT, is neuromuscular re-education of the head and neck muscles. She teaches people how to chew, breathe, swallow correctly, and eliminate oral habits. Myofunctional therapy has now been proven to be effective in reducing AHI by 50% in adults. What's AHI?
Hypopneic index. It's the times you stop breathing.
For obstructive sleep apnea?
Yeah.
So myofunctional therapy has now been proven to be effective reducing AHI numbers by 50% in adults and 62% in children, as well as lower oxygen saturation, snoring, and sleepiness outcomes improve in adults. Joy is a founding lecturer with the AOMT and teaches courses in OMT. Joy is on the board of the American Sleep Apnea Association and the Academy of Applied Myofunctional Sciences. Joy wrote a children's book called Tucker the Tongue Finds His Spot and is currently on the board of the AAPMD, a multi-disciplinary medical and dental group interested in airway problems, where she received a Lifetime Achievement Award March of 2015 for leadership. She also wrote a chapter in Sleep Medicine Clinics published June 2014 that is on pediatric sleep and myofunctional therapy. Joy has lectured worldwide and last year did 2 grand rounds at the Mayo Clinic in Rochester, Minnesota. She feels strongly that OMT will bridge the gap between medicine and dentistry, especially in relationship to TMD and OSA. Joy, you are a legend. Thank you so much for being on my show. Hey, I wanted to ask you, did you see the when you go to a bookstore or you're at the airport, they have that big book by Ariana Huffington of the Huffington Post on sleep. Have you seen that book? Or
Actually, I haven't, but I know they're going to interview me coming up. So
the Huffington Post?
yeah.
Yeah, she's I've loved that lady for so long. I mean, not only is she an amazing CEO, she sold her media company, for a bunch of money, but she's really into the sleep apnea thing, and she thinks it really hurt Bill Clinton's presidency, and because he basically didn't sleep for 8 years, trying to work too many hours and not taking care of his sleep hygiene. That was the most fun thing I loved about dentistry. The thing I love the most about dentistry is all selfish reasons of where when I'd be learning all this stuff, I'd be applying it to me. Like what I loved the most about getting into sleep apnea was realizing when they were talking about sleep hygiene, I did every single thing wrong. And after that 2-day course, I made the room dark. There's no TV, my cell phone chargers in my office, not next to my bed, listening to it ding all night. Even kicked out the 2 cats, made it cold, try to take it more serious. So how did you get interested in this? Tell us about your journey. How did you go from registered dental hygienist into myofunctional therapy?
Yeah, well, I became a hygienist because I wanted to prevent problems, that people have. And I was working for a really great dentist down in Cardiff, California, when I first moved to California. And he opened my eyes to the power of myofunctional therapy because my son had TMD, headaches. He was failure to thrive. He couldn't chew anything. And he had a real high, narrow palate, ADHD, all the symptoms of sleep disorders, which back then was hardly known about. But this dentist, he put him in a little bite piece and he told me to do these exercises. And it was like within 3 weeks, all of his symptoms started changing. And I was just blown away because he couldn't go to school. His headaches hurt so bad. And within 3 months, his teeth started moving and it widened out. And, he could breathe. And his tongue was going up to the roof of his mouth. His posture changed. I mean, so many health things changed. So I decided then I wanted to go back to school and learn everything I could. At the time, there was a guy in Florida that taught CE courses for hygienists. His name was Dan Garliner. And I took his course and haven't stopped since. And that was 1980. So it's been a long time. And then I started thinking, I got to teach classes in this to get more people educated. So I started teaching primarily in Europe, because in Europe, this was kind of standard of care back in the 80s. So I taught classes in Belgium and Germany and Italy and all over. And then I decided, what's wrong with the USA? And I had worked in chiropractors' offices, primarily orthodontic practices in San Diego, and a pediatric dental office. And I would move from office to office and, see their patients. But I kept a low profile because the science really wasn't there yet. But recently, we have really great studies, and Stanford is championing this, and UCLA and Northwestern, Lurie Children's Hospital. And that's why I got called to go to the Mayo Clinic and do some grand rounds. And, the medical profession is used to treating sleep disorders with the sleep study, and then adenoids, tonsils, airway surgery, and then the CPAP. And to be honest with you, a lot of those things are failures. They're not working. They work for a while. If you can get used to wearing the CPAP, it's great, but most people, as you know, can't wear it. They're intolerant of it. And so then the next step is mandibular maxillary advancement. They call it MMA surgery, orthodontic surgery. And even that won't hold if the function isn't addressed. So, and that's where myofunctional therapists come in. We look at breathing, chewing, swallowing, where the tongue is resting, habits. A lot of habits. People don't realize what they do when they're biting their lips or chewing their nails or, sleeping on their face. And a lot of people don't realize that the habits can play havoc with function of the muscles, with normal function.
Well, they always say if you want to change something big, you got to change something small every day. The CPAP, we just lost a Supreme Court justice because his was right next to his bed, and obviously he probably had a long day and didn't want to deal with it, and they found him dead. What did you think of that?
Yeah, I think that dentistry has to rise to the call for help for people. I think every patient that has been given a CPAP should be taught about combined therapy, and they should have the MAD, the mandibular advancement device, next to the CPAP so that they can interchangeably use them. And they need to be told that if you don't have either one on, you may die in your sleep. And I think a lot of education is just not being done. And those mandibular advancement devices save lives. And I work collaboratively with dentists and orthodontists and sleep medicine physicians. Because that's where I feel we can bridge the gap, because the medical profession is looking at myofunctional therapy. They're now calling it myofunctional pathology, and they're doing tons of research on it. And I feel dental hygienists are perfect for this position in the office because we know anatomy and physiology, the mouth, the head, and neck. A dentist won't have time to do myofunctional therapy, but it can certainly help their bottom line, and it can certainly help their patient's health, and it can certainly help them if they're doing sleep or orthodontics or temporomandibular joint disorders, treatment, that we work with the muscles to try to adapt those muscles to the new structure that they're doing, or to help create harmony in the muscle system and deal with the habits.
What percent of the dentists do you think in America today are educated in myofunctional therapy?
Probably, realistically, I'd say 10%.
And what do you think it was? It seems like sleep apnea exploded on the dental scene pretty recently. When do you say it passed the tipping point to where everybody started at least talking about it and hearing about it? And when did it go live?
Well, I think, it started with snore guards and people kind of getting involved in different devices like night guards, the NTI. There's so many different devices now to help people with grinding and clenching. And the research is now showing that a lot of these things are basically the tongue is trying to get out of the airway, so the tongue comes forward and it causes havoc with the muscles and everything gets out of balance. And I think, dentists started looking at what happens with orthodontic failures, because there are a lot of, I wouldn't call them failures, I would just call them relapses, orthodontic relapses. And they're looking at why, did the patient not wear their retainer? Yes, they wore their retainer, but, muscles trump bone, muscles trump teeth. The only thing muscles don't trump is airway. If you can't breathe, your body is going to do whatever it takes, even getting the tongue out of the way. And when that happens, the teeth move. And if they're wearing a mandibular advancement device, which is bringing the mandible forward, it'll keep them alive all night, but over time, not always, but many times, the jaw starts hurting in the morning when they go to put things back. It doesn't sit well. So I think myofunctional therapy can help make the mandibular advancement device more comfortable, as well as we're teaching now an advanced course in sleep, which goes into detail on what we need to do to support not only dentists, but the medical sleep specialists.
So, Joy, how would you, if you say only 10% know it, that means 9 out of 10 of all my homies listening to the show aren't up to speed on it. What would be the best way to learn? I know you're involved with the Academy of Orofacial Myofunctional Therapy at AOMTinfo.org. AOMTinfo.org. Is that a place where you would start your journey, or where do you think the best place to start their journey? I know you're...
That's it right there. If you go, there's tons of research there, tons of information that would help. They can either go there or go to PubMed and type in myofunctional therapy. You'll see there's over 400 studies now. And a lot of them are pretty recent, the last couple of years. Most of the research is the last 3 or 4 years because of Stanford is championing it. Another issue that I would like to talk about is restricted oral tissues like the frenum, the lingual frenum and the labial frenum, and now there's even buccal frenums. A lot of times when the teeth move, like with orthodontics or whatever, normal aging, what happens is the tissues want to go back the way they were. And sometimes those tissues interfere with lip closure, interfere with the tongue being able to rest. A lot of people are being born now with a restricted frenum. And we used to, when I was in hygiene school years ago, we used to say, well, if it's a heart shape, the tongue, then let the speech pathologist worry about it, But now they're saying that the restricted lingual frenums are one causative effect of obstructive sleep apnea and orthodontic relapse, because if the tongue can't rest in the palate, everything collapses around it.
It's interesting that you said Stanford is involved. You think of Stanford, Silicon Valley. You think of Stanford with Google and eBay and Facebook. When did Stanford get involved with sleep?
Well, they've had, since the 1970s, there's been a medical school there, and they've been involved in sleep medicine. They have a very well-known doctor, Christian Guilleminault, who's known as one of the grandfathers of sleep apnea.
Christian, Christian?
Yeah, Christian Guilleminault is Guilleminault.
Wow.
Yeah, he's from France originally, but he's been teaching in the medical school there since the early 70s. And he noticed that a lot of his students were falling asleep in class. And he couldn't understand why. He's like, you're young. You're not supposed to be tired. So he started looking at different things like blood pressure and monitoring different things when they slept. And he and Dr. Bill Dement came up with the whole AHI numbers. And
what was his name? Bill what?
Dement. Dement. Dement.
Dement?
Yeah.
And that's the guy who came up with the AHI numbers?
Actually, Dr. Guilleminault did. He was the one that first named the apneic-hypopneic index. Anyway, I guess it was about 9 or 10 years ago, they had me come up there and do grand rounds with their sleep medicine department. And I gave a 3-hour lecture on airway, breathing, and chewing, swallowing, and myofunctional therapy, which he knew about because in France, since the 1920s, they had been doing something, they called it myofunctional re-education. And he knew that there was a value in that. Well, in France, there was a lot of socialized medicine. So they included 2 years of myofunctional re-education in their medical facilities. So he knew about it, but he didn't know what he didn't know, because I showed a video of a young lady who had severe sleep disorder. She would wake up every hour. She was only like 18 years old. And she had speech problems, she had TMD, she had scoliosis, she had all these problems. And then I showed a series of videos on her. She also had a restricted lingual frenum, which she had released. He didn't know about that, and that was like an eye-opener to him. So he started doing research on myofunctional therapy and sleep and the tongue, specifically on what happens with restricted frenums. And so he's championing that now. And I'm very excited to be part of their team.
Is he an MD?
Yes.
What percent of people with obstructive sleep apnea do you think need to have some of these frenums incised or lasered?
I would say at least half.
At least half. Wow. That is amazing.
It's huge. It's huge. It's so big.
So you gave that 3-hour lecture at Stanford. How do I get that 3-hour lecture on Dental Town? There's 215,000 dentists and hygienists on it, and on the app, we came out with the app. It's up to 50,000, 1,000 new dentists or hygienists a month, and we put the online CE on there because we put up 350 courses. They've been viewed over 600,000 times. I would love to get you on there and your.
Well, I did it once, but there were a lot. This was maybe, I guess, about 8 years ago. I did a 1-hour thing on myofunctional therapy.
You did the myofunctional therapy, a critical missing element in complete patient care.
But they took it down because at that time there was a lot of politics going on, and they thought that I was too outside the box.
What year was that? What year did you put that up?
That was maybe 8 years ago, something like that, 8 or 9 years ago. But it was up for a while. There was a lady dentist that you had working with you.
Rita.
Yeah, she's the one that did it with me.
Rita Zacher.
Yeah, she was real nice.
So have you talked to Hogo about this, Howard Goldstein?
I don't know.
I'm Howard at dentaltown.com, but we got two Howards. So his name's Howard
Goldstein. Goldstein and Garber, you're talking, right?
What's that?
You're talking Dr. Goldstein?
No, Howard Goldstein. Email me, Howard at dentaltown.com, and CC him, Hogo, Hogo, at dentaltown.com. Dentaltown's tough. I mean, you got 215,000 dentists, and they can't agree that today is Thursday. It is and anything new, you know how people like anything new, if it's not the way they learned in dental school. But this is, I agree, 8 years ago was a different world. And then it seems like about 5 years ago, the entire planet started to wake up to sleep. And now Arianna Huffington's got a New York Times selling book on it. And then she's going to interview you on this. And like I say, I've been taking all the 2-day courses I can on it, and trying to do a lot of podcasts on it. And I had the sleep study done on myself. I've changed sleep hygiene stuff. I was this last, on Memorial Day, I was at a party, and this mom's complaining about how one of her kids is a runt, small. And he's laying there on the couch, sleeping, grinding his teeth. I could hear it in the next room. Yeah. And you see this little kid, and you're just thinking, God, we only know what we don't know. How much of this kid's lack of development is because and then I said to Mom, I said, do you ever sleep with him? She goes, yeah, I sleep with him all the time. I said, what's it like when he's sleeping? She goes, it's like sleeping with a wild tiger. And it's like, so
around because the body is trying to say, wake up so you don't die in your sleep. The kids get very,
if this sleep stuff is it's still not sinking in because it's not what they learned in school. Maybe we could get Christian to do a podcast after you, kind of a 1-2 punch, or maybe obviously someone from Stanford. That's going to bring a lot of massive credibility to the science of this. What do you think about that? Do you think he'd be game for any of that?
I don't know. We could check with him. He's pretty busy.
Oh, I'm sure he is. But you know what? My experience is, if you want to get something done, give it to the busiest person you know, because busy people, they just always get it done. Give it to the laziest person you know, it'll never get done. Give it to the busiest person you know. So yeah, ask Christian, and maybe he'll do the podcast with me after you. We get kind of a 1-2 punch, and
that sounds great. He might just do it. He's real friendly with our association and the AMS. He spoke at our association. We had a big conference last September at the Biltmore in LA, and he was given a big award, and he spoke. And there was over 500 people there. That was the first time we had the meeting here in the States. So we're going to have another one.
You were talking about the meeting for the AOMT?
No, we have a nonprofit organization called the AAMS, the Academy of Applied Myofunctional Sciences. And our next conference will be in March, the first week of March at the Fairmont Hotel in Chicago. And we're expecting about 1,000 people to come.
Wow.
Yeah, it's huge.
Nice.
It's huge. It's like, you know, if you think of it logically, I'm going to hold up some pictures here of the tongue. The tongue is supposed to rest in the hard palate, and if it's trying to get out of the airway, it's not going to rest there. It's going to come forward, and everything's going to collapse. And you all know about the Monetizing score, right?
Explain it to my homies.
You know about that, right?
Mm-hmm.
A lot of people don't even check that in dentistry.
Well, explain it again.
Well, if the tongue is not resting in the right place, the soft palate collapses down. The Monetizing score was developed by an anesthesiologist who would score the opening, so he knew what size tube to use. It's still being used in all surgical procedures in hospitals. But also another problem that we really need to look at is posture. And I know everybody knows that if you can't breathe, your head comes forward. But also, if your tongue is restricted, your head comes forward. There's a study out of Italy where they did, I'll hold it up, the Olivis, or two MDs. Can you read that?
Mm-hmm.
I just want to show you this one picture in here. This is like before and after, 4 months after a lingual frenectomy. Can you see how the posture changed on that patient? So it's critical to posture problems too, and scoliosis and how the curvature of the spine. If the tongue is not right, the tongue is actually the rudder for the spine. And if the tongue's in the wrong place, everything starts collapsing. And not enough emphasis is, we're trying to get a law passed eventually that all babies at birth will have their tongues checked for restriction. They actually passed that law in Brazil. So Brazil's kind of been the leader in myofunctional therapy because they've had over 30 universities doing PhD level work in the field.
Brazil is an amazing country. It's 200 million people. I mean, can you believe that? It's 2/3 the size of the United States. And I think the fact that they're in the southern hemisphere, they're 200 million people. They kind of have gone their own direction in free, whereas kind of Europe, there's kind of a lot of cross-pollination of all the thinking and the ideas and all that. The Brazilians are amazing people. You talked about the website AOMT, and you say that is where you would go to start. But you also talk about another website, AAPMD, American Academy of Physiological Medicine and Dentistry. How is that different? Talk about that website.
That organization is made up of I don't know if you know Harold Gelb.
Yes.
His son Michael Gelb and Howie Hinden started that organization. I was at their first meeting. And they're more concerned about airway, and they're open to every profession. So it's the American Academy of Physiologic Medicine and Dentistry. And again, it's trying to bring medicine and dentistry together to fight the airway problem. Their next meeting is in Tucson in September. And it'll be a fabulous meeting.
My God, that's only an hour and a half drive for me. That's only 90 miles south of Phoenix.
Yeah.
Do you have the dates on that?
Let's see. I can look it up. But if you just go to AAPMD, you'll find them. I think it's the third weekend of September. Yeah, if you just go to AAPMD, you'll see it. But it's a great group of doctors and dentists and every healthcare professional, nurses and all different physicians, integrated medicine doctors. They chose Tucson because there's an integrated medicine meeting at the same time. It's a great group of dentists that are involved in that. as well as hygienists.
Well, Joy, you and I have been in this boat called dentistry for many decades, and I want to ask you about money because the X-ray machine was invented by Röntgen, and it was available for years and years and years, but a dentist didn't touch it until the beginning of dental insurance, which I believe was 19. I think it was. God, I'm getting confused. I'm so old. It was at 48 or 58. I think it was 48 in New Jersey. The Longshoremen's Union shipbuilders started dental insurance, and then right after, and then they covered 100% for X-rays, and then Delta came along, and I mean, you could look at the United States; it looked like a pintle of dominoes because everybody could walk in there from Patterson, Shine, Benco, and Burkhardt and say, "Well, you buy this machine, and it's covered 100%, and you have this many patients. I mean, you buy this every dollar you spend on this machine is going to make you your dollar back and another dollar." So I have to ask the ugly question. Money's the answer. What's the question? Can dental offices make money in myofunctional therapy?
Absolutely, absolutely. There are so many. Once a dentist comes to our class, and we teach in our class, we have three like a series of classes, but even in just the first class, we go into practice management quite a bit. I feel very strongly that every dental office needs to have this available for their patients. Patients appreciate it so much, and you'll get tons of referrals. And the people that are coming for myofunctional disorders, a lot of people know they have tongue thrust or they have their mouth breathing. There's so much out now about mouth breathing and why mouth breathing is so detrimental for your health. So if you're doing training on tongues and breathing, people will come in. Those people are the people that need a sleep study, that need a mandibular advancement device, that need other procedures. They may have TMJ problems. They may have orthodontic problems. They may have, so many problems that are dental problems. Decay, periodontal disease. Periodontal disease is one area that I feel so much is involved with the myofunctional disorders. Because if you're mouth breathing, the pH of your saliva is different. And I was at a conference in Washington where the instructor was one of the instructors from a hygiene program who had taken my course about 5 years ago. She came out and she said, she held up a roll of tape and she said, "This is the new dental floss because the pH of your saliva will change if you're nose breathing. Also, if your tongue is pushing against the teeth, you swallow 500 to 1,000 times a day. If your tongue is pushing against the teeth, what's that going to do to the ligament?" So the biofilms are different in mouth breathing. The pressures are different, and then your teeth start shifting, and so there's so much more room for plaque. And also, what happens to a lot of people who are mouth breathing, they don't want to chew their food enough. So instead of chewing their food, they reach for soft food, for processed food. And that breaks down their whole health. As we know, nutrition is extremely important for this whole sleep thing. Because if you're not chewing, because you're mouth breathing, your brain says, "Hurry up and swallow the food," because you don't want to. You want to breathe. You want to make sure you have your next breath because your brain is thinking your mouth is your nose. And so chewing breaks down, and then processed foods increase. And decay increases. And it's extremely preventive. And so I think if you have that available, we have on our website, Find a Therapist Near You. And people are always going to that to find a therapist, then, you're in like Flint.
So you talk about that 10% of dentists are probably have looked into myofunction?
They have an awareness of it. They're probably not including it in their practice. Maybe 5% have it included. Most of them just refer. Like
Okay, I would have switched from general dentist to orthodontist. How is this going over with the orthodontist? There's
it's
10,000
a
orthodontists. What do they think of this?
it's a mixed bag. They either love me or they hate me. I find that the ones who are using a lot of headgear and by retractive headgear and bicuspid extraction, they're hanging on to that. You know, they think that that's not going to hurt anybody, and they don't need myofunctional therapy unless there's a problem later after the braces come off. But a lot of them, pediatric dentists especially, are getting more and more involved in myofunctional. But orthodontists, I'd say, because I'm in LA, you know, Beverly Hills, and there's a lot of orthodontists here. I would say the ones who, I either get referrals from the guys who understand airway and they want to get the tongue out of the way before they put the braces on. You know, we work back and forth. Like myofunctional therapists also eliminate thumb sucking and nail biting and all that. So they'll send me a thumb sucker. I'll get rid of the thumb and then I'll refer back to them for some palate expansion. So they do the expansion and then they refer back to me for the myofunctional therapy. Then I refer back to them for the braces, you know, so we work hand in hand together and it works beautifully. And then
where are you working right now?
I have my own practice.
You have your own practice?
I have my own office. Yeah, I have my own office in Pacific Palisades and I have 6 employees. There's 2 other myofunctional therapists. I have my personal assistant and an office manager who also is a didgeridoo player. So he teaches some of my patients the didgeridoo, people that want to learn that. And then I also have a breathing educator who exclusively does the Buteyko breathing exercises. And that's another big you know, it's not for all of my patients, but a certain percentage of them really need to have their nasal breathing become the primary way they breathe. So we do behavior modification in myofunctional therapy, but the Buteyko has taken everything up a level. So
I don't remember the exact details, but I know all the professional athletes talk about how when you breathe through your nose, it makes some type of more nitric acid or something in your oxygen, and you have higher performance breathing through your nose than your mouth.
Mm-hmm. But it helps your sports performance, endurance, and all that. But it also sterilizes the air, so you're going to have less sinus infections. And
so, if the orthodontists either love you or hate you, maybe for your haters, who would be your biggest fan orthodontist? Which board certified, or if you got any board certified orthodontist,
yeah,
have them email me, Howard at Dentaltown, and we'll more information. I mean, I love it when you know everybody needs to take their mind out for a jog, and instead of listening to something. In fact, there's probably a guy might be listening to this right now that heard me lecture back in like, oh my God, back in the day, like 1990, and I made a joke about environmentalists, you know, but it was a joke, but you know, I hadn't thought a lot of time. And he sent me this book, and it was made out of recycled plastic. It was Jason Lutchfield, and I forgot the name of that book, but anyway, it was he knew my mind, he knew I was business, he knew I was a dentist, but he didn't think I really respected the environment. It was something about sustainable growth. But anyway, he sent me a book, and it just totally opened my entire mind. So if you got some orthodontists that board certified, think outside the box. I'd love to podcast interview them too. Maybe they can help you on your online CE course. Because I remember, I mean, 8 years ago when you put up myofunctional therapy, when Rita Zacher, who's a dentist and an MBA from Canada, when she put up your course, a critical missing element in complete patient care, it was controversial.
It was.
But back then, no one talked about sleep, and now you can't pick up a journal or a magazine or a newspaper. I mean, like say Ariane Huffington's book, it's all over every bookstore. They have an entire freestanding deal about her book.
Yeah, well, it's not just sleep though. It's also temporomandibular joint disorders. I know last year I lectured at the AAOP, the American Academy of Oral Facial Pain, and they're starting to,
AAOP.
yeah, American Academy of Oral Facial Pain, and the AACP. I've lectured at all of those places, and they're starting to know. I asked a group of pain management specialists, oral pain management specialists, what percentage of TMD is related to the muscles. And across the board, they said at least 90%. So if 90% of TMJ is related to muscles, myofunctional therapists what we do is repattern those muscles. We work with the lateral pterygoid muscle, with masseters temporalis, the chewing muscles. Of course, the tongue is an organ. It's not really a muscle, but we work with all the muscles like the genioglossus muscle and all the muscles inside the tongue as well. So you can see where we could be an adjunctive treatment to splint therapy or Prolo or whatever type of TMD therapy that they're doing. Because we can help stabilize and balance the muscles, the patterns. A lot of people, they have a toothache and they start chewing on one side only. And even though they get the tooth fixed, they still keep chewing on one side only. And their facial muscles can be needing some retraining, just like we're kind of like a personal trainer for the head and neck muscles, different from a physical therapist. Although now a lot of physical therapists are starting to take our course. We're getting physical therapists, occupational therapists, sleep specialists, a lot of dentists take the course, hygienists, speech therapists. I'd say, even last course we taught at UCSF, we had an ENT in there who was just on fire with this. He thought it was great. So, it's a very diversified class because we have different professions, we have different philosophies, and they all come together to learn how the tongue can help the airway and to stabilize and prevent problems, because the problem with sleep apnea is huge. It's huge. And it is related to TMD problems as well.
So are you, you're the owner of your business?
No, it's my son, actually. I used to be the owner, but my son.
But I mean, is your son a dentist?
No, he worked on Wall Street. He had a business background.
So then you're an independent. So you're then a hygienist, independent practitioner.
Yeah, I'm in the state of California. It's legal for hygienists to do myofunctional therapy, and because dentists don't know about it, we don't have to work under the supervision of a dentist because they weren't taught in school. So, hygienists can work independent of a dentist doing myofunctional therapy.
In California?
Well, I think it's in every state because there's no rule that says you can't, you see? So it's like a hygienist can open a candy store, right?
Right.
She doesn't have to work under the general supervision of a dentist opening a candy store. So until there's licensure in this field, anybody can do myofunctional therapy. We don't train anybody. We only train healthcare professionals that have a background that would be suitable to do this.
That is very, very interesting. I think a lot of how many hygienists do you think are there in the United States?
There's at least 150,000.
And how many of them do you think work?
I'd say probably at least 70%, I would think.
Yeah,
part-time work or something.
Yeah, a lot. Yeah, that's what most of the studies I've seen on registered nurses and hygienists, 4-year college degrees, when occupied by female, about half of them are active and half of them are not, whether they're home having children or what have you. But how many of those 75,000 hygienists that are working today do you think are aware that they could open up their own office in obstructive sleep apnea or myofunctional therapy?
Probably hygienists are a kind of a different breed. They're not, they don't think independent. A lot of them, even when they take our course, they're frustrated. They go back and talk to their dentist, and their dentist says, well, we don't need to do that. I want you to do more root planing, you know. And then the thought of going out and marketing, the thought of going out and talking to professionals, because, you know, when you get started, you have to do lunch and learns and, you know, get brochures and cards and, you know, do outreach things to the community. But a lot of hygienists don't want to do that. They really don't. They really, really don't.
So you know
They're
who
not.
might you know who might be a part of your target market also is I've noticed a lot of people in the 500 dental manufacturing companies in the United States. A lot of the best reps are hygienists. Have you noticed that?
Mhm, mhm.
And I mean, whether they're working for Colgate or Crest or you know Shine or Patterson or Benco, I mean, some of them uh, that might be an interesting thing to go over them with. So does so you think you're gonna do you think this revolution is continuing upward and onward, or do you see problems?
You know, any new profession, it's really not a new profession, but any profession when it's going against, or not going against, but trying to integrate it with current standards of care is going to have bumps in the road. They really are. But I think the public demand for this service is going to be huge. You know,
And are
we have invitations to do all kinds of different TV shows and everything. We're holding back until we get a critical mass of people trained.
and are these people coming in and paying cash, or are you billing medical insurance or dental insurance? How does this work?
You know, lately I've been getting really good. I could get Jonathan to come in here. He's my insurance guy, but we've been
Do
getting.
do have him come in. Jonathan, how are
Hey,
you?
how's it going? Good and you?
Good, buddy. How are you doing?
Good.
I love your earrings. I can't wear earrings, or everyone will think I'm Mr. Clean.
Right.
Are
Thank
you old enough to remember who Mr. Clean was from the
I do actually, yes.
so you know the crude rude side of a lot of this is the dentists are thinking, well, you know, is there money for this? Does insurance pay? I think one thing, Joy, one thing you're going to have difficulty. They're saying, oh well, come on, Joy's in Beverly Hills. Those people can buy Lamborghinis with their spare change. But what about insurance? Does medical insurance, dental insurance, Medicaid, Medicare? Talk to us about the money side
So
of it, Josh.
currently right now, what I've been noticing that a lot of the insurance companies are being a little flexible on the reimbursement aspect of the insurance. If you ask them in the beginning, like, oh, can I get a pre-approval for this? They're typically going to deny you just because they have no idea what myofunctional therapy is. So as as like the office and the therapist, we have to kind of educate the insurance companies and letting them know what it is, especially when it comes to hygienists, SLPs that were it's under their scope of practice to do this profession. And 90% of the time, the people who are approving these type of like procedures, they have no background in medical. So you do have to educate them. But to answer your question, the ones that I've noticed that are pretty much a-okay with doing this are like flex pay accounts. The ones that like you could put money into it, you could just swipe away with those. That would be the number one choice that I would use. After that, I would do the reimbursement process, which basically is that the patient would have to pay out of pocket, and then we would submit a super bill with medical codes to turn into their insurance companies about 8 visits after they've gotten their what's it called treatment. So
Yeah.
And so this would be medical insurance, though.
It would be-
Medical codes.
What we do is we include the research, and we include a letter of medical necessity. We include a note from their primary care physician or their dentist or both, saying that they recommend the treatment, but it is not done in their office. We include our scope of practice as a dental hygienist. The American Dental Hygiene Association has had it in the scope since 1992. So we include a copy of that. We highlight all the areas where it says that myofunctional therapy helps sleep disorders or TMD or orthodontic relapse. We highlight that, send it with the patient. The patient does their own, submission on this. It's and the super bill with the codes, the current codes. And in the course, we're taught how to do that. Blue Cross is paying pretty good. Some of the other companies have paid, depending if they've met their deductible and so forth. So, but we don't promise to have the insurance company pay, but we try to get, especially if they have a diagnosis of sleep apnea, if they have a sleep study, we include a copy of the sleep study with it. So, and then we teach the patient that if they deny it, we'll help them appeal it, and then we'll have them go to the insurance commissioner in the state. It's kind of, Howard, it reminds me of when I first started as a hygienist. They weren't paying for fluoride treatment, and then they weren't paying for sealants. But if you keep submitting and submitting and submitting, then they started paying. But I do get some coverage for this. Sometimes they pay the whole thing, especially if they're having MMA surgery.
What is a typical patient? You said it's 8 visits?
Typically, we do 8 visits because they're done with their phase 1 of the treatment.
So phase 1 is usually 8 visits, and each visit is like how long?
Half
an hour.
Half an hour. And is that always with a hygienist or
It could be
a speech pathologist or a physical therapist, who's ever doing the therapy. Yeah.
And how much is a visit for a half hour?
Well, we don't break it. We charge for the whole treatment, like ortho. You don't charge per visit.
So you charge for the 8 and
charge for a whole year of treatment.
Oh, you charge for the whole year. And how much is a year of treatment?
It depends. There's a sliding scale somewhere. It's the way I teach it. I don't know. The way we teach it, it's about a third of the ortho.
About a third of the ortho.
Yeah, if the orthodontist in your area is charging, $10,000, then it's around 3. So it's about a third. And that includes all the equipment, because there's some equipment that goes with it. And it includes all the visits. So most patients.
What do you mean equipment?
Oh, we have different chewing devices, different gadgets and gizmos that we use. It's a whole kit. You want to see it?
I do.
You're so great. You're so open. Well, this is a typical kit. And it comes with.
And it said AOMT on the outside of that bag. So
yeah, AOMT.
You buy that from the AOMT.
Well, we make ours ourselves, but there are companies that make the stuff, and it just has different gadgets and gizmos and different things. A lot of these things you'll recognize that have been in dental offices, so not that expensive.
Well, I always love a good pioneer, Joy, and you have been a pioneer for a long time. I'm a big fan of you have 1,000 posts on Dental Town. 1,000 posts.
I love Dental Town. I feel that it's a wonderful way of educating people. That especially brand new dentists. They're very open. They want to learn new things, and they don't have preconceived negative thoughts. So we can get them when they're young and teach them this stuff. And we have the evidence-based, you can see like some of these patients with the open bites and how they close, and, I've treated thousands of patients, and some of them are very sad. I have a lady right now who's had 6 orthodontic surgeries, 6, and nobody looked at her tongue tie.
The young millennials or Generation Xers are doom and glooming about, the whatever. I always walk them through human history over the last, 100-year increments, just showing that for every 100 years, it's everything just so much better. So you're like people are very upset about, say war now. Well, compare war now to World War II, and then compare World War II to the Civil War. I think that there's we only know what we know, and there's just so much we don't know. And 1,000 years from now, do you realize how crazy we're all going to look? I mean, look at a root canal. They're going to be saying on TV, back in 2016, when a human had a toothache, they would drill a hole in the top of the tooth, take these metal barbs, pull the guts out, rinse it with bleach, and smash rubber down into the tooth while the human was alive. And everybody in the year 3000 is going to think we're cavemen, the Flintstones, Neanderthals. So when these kids come out of school, or these dentists have been practicing for 20 years, then they say, they just say, oh, that's not true. It's like, well, can you cure TMD? Do you know? If you don't have the cure to a migraine or cancer, then why is the book shut? I mean, you hear oncologists say, well, that's not true. And it's like, well, can you cure your patient of that cancer? Well, if you can't cure your patient of that cancer, you obviously don't know the whole story, because if you were really half as smart as you think you are, you would cure all your patients of that cancer. So there's so much that we haven't learned. I don't even think we've learned 10% of knowledge.
Cancer, the lateral border of the tongue is very commonplace for squamous cell carcinoma. But if that tongue is pushing against those sharp cusps, it's a chronic irritation that nobody has looked at as being a myofunctional disorder. And also if you're mouth breathing, that's been proven by David Ghazal that intermittent hypoxia can cause cancer.
Well, I want to help your crusade. Refer me some orthodontists from your hometown because I know orthodontists will listen to other orthodontists. They're not going to listen to me because I'm a general dentist. I'm not even worthy enough to get on OrthoTown.
Pediatric dentists, we have
If you got some dental specialists that do this, because I know what my homies are going to say. They're going to say, well, if they didn't learn in dental school, that whatever. But send me some more pediatric dentists, some orthodontists, and if you get that Stanford guy, that'd be amazing too. I think they'd all listen to Christian from Stanford. But it sounds like he's the inventor of the AHI. But hey, Joy, thank you so much for spending an hour with me today. I do think you should change your last name spelling to Moeller, like the tooth. Just like I told a hygienist a year ago at my seminar, her last name, her name was, that wasn't her last name, her first name was Candy. And I told her, you just cannot be a hygienist named Candy. I mean, there's just, or maybe she should go by Dr. C. But hey, Joy, thanks for an hour of your time. Thank you for all you've done. Congratulations on your Lifetime Achievement Award from the AAPMD. That had to make your day. And I hope to see more of you on the boards.
Okay, we'll be there.
All right, thank you very much.